Hi, I'm Justin Riley. Today on Wisconsin Doctors, orthopedic surgery and treatments, when it's right for you and how best to recover. We're on location at Bluff Medical Center in Mauston to find out more, and my guests will include Tiffany Hall, certified medical assistant in orthopedics. Tiffany received her training from Southwest Wisconsin Technical College in Fenimore and has been with Bluff since 2012. Dr. Bob Ridley received his orthopedics training at Ohio State University and has been with Bluff since 2008. Dr. Aaron Butler received his training from UW-Madison and University of Florida and has been with Bluff since 2014. And Marlene Rosenberg, physical therapist and director of rehabilitation services, received her training from University of Michigan and has been with Bluff since 2009. It's all coming up right here on Wisconsin Doctors on CW57. Stay right here. Welcome to Wisconsin Doctors. I'm Justin Riley, and it is a beautiful day here at Bluff Medical Center in Mauston. And my first guest is Tiffany Hall, who's a certified medical assistant specializing in orthopedics. Welcome.
Thank you.
So tell us, how did you get involved in orthopedics?
Well, I was hired here by the clinic in 2012 to work with the new orthopedic providers that were joining the orthopedic staff here, which consisted of Dr. Ridley at the time. That was Dr. Brucker and Dr. Liebert, and since then we have added Dr. Butler to the staff, so we now have 4 orthopedic providers that patients can see here at Bluff.
Awesome.
Tiffany, a lot of times people have a question as far as whether they should go to see an orthopedic doctor or maybe see their family doctor first. Can you give an idea of what would be some good things that people should really start out seeing an orthopedic doctor?
Well, we see patients for a number of different things, ranging from carpal tunnel syndrome, tendon and ligament injuries, knee problems, hip problems, shoulder problems. A lot of those patients will start out seeing their primary provider, and then they get the referral to us in orthopedics. Some patients make their own call to say, hey, I'm having this problem with, say, my knee, and then we get them scheduled for that. So it's just a large list of things that they can see orthopedics for. So,
absolutely.
Okay. Tiffany, in a typical clinical day, what kind of roles do you fulfill?
Well, I, besides our reception staff, when they check in at the desk, I'm usually the first person that they see before they see the provider. I bring them back to the rooms, get vitals on them, get more information on what's going on with the problem they're having, if they're having knee pain, you know, if there was an injury, when it started. And then once the doctor comes in and evaluates them, they will come out and tell me whether we need to order, say, an MRI to see if there's a tear like a shoulder, a rotator cuff tear, and then, or any surgeries if surgery needs to be scheduled. I review the initial surgical instructions with patient and order any other tests that the doctors feel that is needed for that patient at that time.
So you're kind of responsible for like the intake of the patients when they come into the department.
Yep.
Yeah, absolutely.
Well, it sounds like you have a lot to do working with these gentlemen up here. So what would you say is your most rewarding part of your job?
I think the most rewarding part of my job is seeing the results that the patients receive in follow-up in clinic. Like if we give them a steroid injection, if they come back and say that worked very well, you know, I mean, it took my pain away. Or if we've scheduled surgery and they come back for their post-op and they're like, oh, it's 100% better. And I do like the staff, the group of people that we work with here at the clinic. So.
It's a good place to work.
Yes.
It's a good place to come and film a show, too, as I found. So I'm wondering if you could talk to us a little bit about joint camp. This is something that's kind of a new thing that I haven't heard of yet. Could you tell us a little bit about that?
Sure. Joint camp is when patients who are having total knees or total hips done here, they are scheduled to attend this joint camp, which consists of a representative from the OR, anesthesia, social services, acute care, therapy, and the pharmacy. It's usually an hour-and-a-half session that they meet with everybody at once, and they go through things before surgery, what's going to happen after surgery, and in follow-up, so that they're not coming in and out of the room following surgery, you know, and the patient kind of has an idea of what is going to happen, and they can answer any questions at that time as to whether, you know, if they have any concerns or what's going to happen after, when am I going to see these results. So,
Sure.
yeah.
Very cool, very cool. So it's kind of an opportunity for them to kind of get familiar with the whole continuum of care, so to speak, there in that area.
And it kind of relieves any fears or concerns that they have to meeting with everyone at once, and they explain everything in detail to the patient and kind of help them.
Great, that's awesome.
Yeah.
So now, if we just have a few minutes left, or a few seconds left, I should say, but if I'm experiencing knee pain or ankle pain or something like that, should I go directly to an orthopedic, the orthopedics department? Where should I start?
Well, I guess it, you know, just depends. A lot of people don't really know where they should start, so they'll start with their family practice provider.
Sure.
They'll get x-rays, you know, if anything is, if they see a true concern, they will contact our department and ask if we can see the patient, or, you know, they'll contact the doctors directly and say, hey, I have this problem, can you see this patient for this?
Sure, so it's usually like a referral from a family
Most
practice
of the time,
or primary
yeah.
care.
Yep.
Great, excellent information. Well, Tiffany Hall, thank you so much for the information today. We're talking about orthopedics here at Mile Bluff Medical Center on Wisconsin Doctors. Don't go away, there's more to come. Welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center in Mauston, and we're talking orthopedics. And my next guest is Dr. Bob Ridley, orthopedic surgeon here at Mile Bluff. Dr. Ridley, welcome to the program. Do you like Dr. Bob?
Yes.
Okay, I like that too. So, can you tell us exactly what it is that orthopedic surgeons do?
Sure. Well, it comes from really what the word orthopedics means. There's two Greek words joined together. The first one means to straighten or to correct. The second one means a child or an infant. So originally orthopedics had to do with the correction of deformities that kids were born with. Eventually that was spread out to all ages and to different types of deformities, including fractures and dislocations. But orthopedic surgeons like Dr. Butler and myself, we take care of a widespread variety of problems that affect the bones, the joints, the muscles, the tendons, the ligaments, not just deformities. It can be tumors or infections. It can be sports injuries, work injuries, different types of arthritis. And we're experts at being able to evaluate and to treat these various conditions.
Yeah, so the spectrum of things that orthopedic surgeons do has really broadened over the years.
It has, and it's one of the things that drew me to become an orthopedic surgeon in the first place.
Yeah, absolutely.
Hey, Dr. Ridley, other than working with me here at Mile Bluff, what do you like about being a surgeon here at Mile Bluff?
Yeah, that is indeed a good pleasure to work with you, Marlene. But what I like about being here,
the love in this
what I like about being an orthopedic surgeon here in Mauston is that it's a small town, and I really enjoy the small community and knowing people in the community. And for such a small place, we have a wide breadth of expertise and ability to take care of people here, so that people don't have to go to big cities to get the care that they need.
Wonderful.
Bob, over your years of experience with total joint replacements, what are some of the most significant changes you've seen in the field?
Well, I started out in the late 1980s, so that's been quite a while. And back then, people who had hip replacements, knee replacements, they would be admitted to the hospital the night before. They would stay in the hospital for a week or a week and a half afterwards. Nowadays, people come in the same day of surgery. They go home usually within about 3 days or so. And part of the change between then and now is that we've learned how to do a much better job of taking care of people's pain afterwards through a variety of techniques. We've learned how to adjust people's therapy so they get moving quite a bit sooner, able to go home sooner, right where they want to be.
Awesome, yeah. Getting people home, that's the key. People want to go home.
Dr. Ridley, I've been hearing some advertising from an orthopedic surgeon in the area that he uses custom-made knee replacement parts. What is your opinion on this new technology?
Well, Tiffany, I'm glad you asked. That's a good question. And It's a little bit misleading to say that it's a custom-made replacement, because for most of the systems, the custom-made part is not the replacement part, the new covering you're putting on the worn-out ends of the bones in the joint that has arthritis, but it refers to the custom-made instruments or tools that are made to help the surgeon line up the replacement and the joint to what hopefully is a normal alignment. It's a good goal to have because the better alignment that the joint has, hopefully the better mechanics it has, and it will last a longer time. It does add a lot of cost to the procedure, because instead of the surgeon relying on x-rays and his own experience and judgment to do this, the surgeon who uses those custom-made devices will send an MRI scan or a CAT scan to the manufacturer that makes the replacement. They'll use computer software to decide how to make the various cuts or how you actually going to do the procedure, and custom makes the instruments that hopefully will help that to happen. Unfortunately, it's not really panned out to provide a more reliable alignment or affect the long-term outcome of how people are doing after the replacements are done. So I think it's more of a gimmicking thing now rather than something that has made an advancement in being able to do a knee replacement.
Before we go, Dr. Ridley, just wondering if you could quickly kind of talk to us about the differences between arthroscopic surgery and then open procedures, and what are the advantages and disadvantages of each one?
Sure. Well, with any type of surgery, you have to get from the surface down to where the problem is.
Right.
And in the old days, that was a big open procedure, a lot of surgery damage to get down to the problem. Now we can make little cuts around the joints, do it much more quickly. A lot of times you can actually see better, do it better, less pain, less stiffness, a lot quicker recovery.
Awesome, awesome. Dr. Bob Ridley, orthopedic surgeon here at Mile Bluff Medical Center. Thank you so much for the information.
You're welcome.
Don't go away, we got more Wisconsin doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're on location at Mile Bluff Medical Center here in Mauston. It's a beautiful day here today, and we're talking about orthopedics. And my next guest is Dr. Aaron Butler, orthopedic surgeon here at Mile Bluff. Welcome.
Thanks for having me.
So there are so many different career paths or specialties that people can choose when they go into the medical field. What made you choose orthopedics?
I knew at a young age I wanted to get involved in medicine, and then through an injury of my own, playing football in high school, met an orthopedic surgeon who did surgery on my knee, and kind of stuck on him at that point. He kind of allowed me to shadow him and mentor him through some surgeries in clinic, and just realized that it was a profession where I could work with people on a daily basis, work with my hands, and make a quick change in people's lives.
And it's a very personal thing for you, having had that injury
Yes,
in the past, I'm
yes,
sure.
yeah, absolutely. Yeah.
Dr. Butler, what particular interests or specialties within orthopedics do you have?
I am a general orthopedist, so I tend to see all types of orthopedic injuries. Through the years, though, you tend to kind of focus or find things that you become more interested in. I would say at this point in my career, I have a stronger focus in shoulder surgeries, be it rotator cuff repairs and injuries and such. I like doing total joints, hips and knee replacements. Also a fair amount of knee arthroscopy, from ACL reconstructions to meniscal repairs. But obviously with general orthopedics, we cover a wide breadth of procedures, everything from fractures and trauma to nerve-type injuries, carpal tunnel syndrome and the like. So.
Absolutely.
Well, Aaron, I have an old knee injury and starting to get a little bit of arthritis. How do you like to help people with either hip or knee arthritis avoid a replacement surgery?
It's a very good question. Very common injury and pathology that we see on a daily basis, as you see in physical therapy.
Yep.
I think one of the most important things that we can't stress enough is control of our weight. The hip sees about 5 to 6 times your weight with each step. Your knee sees about 3 to 4 times your weight with each step. So when patients tell me they can't lose weight, I tell them even simply a pound or two can make a significant difference on an arthritic knee. So that's probably first and foremost. Keeping the joint strong. We can't reverse the arthritis, but the stronger we keep the muscles surrounding and crossing that joint, the more we can stabilize that arthritic joint and can deter or decrease some of the pain experienced.
And can you specify what you mean by when you say the hip sees 3 to 4 times our weight?
The physics of weight bearing and what they call joint reactive forces, or the stress that joint sees. For instance, going up a single step on a stair, your hip will see 5 to 6 times your body weight with each step.
So if you weigh 200 pounds, we're talking like 1,000 pounds.
Exactly, yeah, 1,000 to 1,200 pounds. So you can imagine even a 5-pound difference is a huge change in an arthritic joint, and I'm sure people have experienced that in the audience. Even a few pound weight loss, you notice the difference going up and down stairs, less winded, less discomfort, less stress.
Yeah, definitely.
And that's what your joint sees on a daily basis with that weight. In addition to the strength training, a regimen of oral anti-inflammatories, or whether it be over-the-counter medications, ibuprofen, naproxen, or some prescription things that we can prescribe can help. And we'll also, sometimes when those modalities are failing, utilize injection-type series, so cortisone and such.
Sure.
And it works quite well.
Now, we've talked about a lot about lower extremity things. What happens if somebody has increased hand numbness or finger tingling, things like that? Is that something I just have to live with?
Well, it's one of the more common things we also see, and it's, family practice will see it, in neurology, orthopedics sees it quite often, but one of the most common things we see is carpal tunnel syndrome. And it's a numbness or tingling caused in the hand by compression on one of the 3 nerves that operates the hand. And so if you're experiencing intermittent numbness or tingling, if it's causing you to awaken at night with your hands numb or tingly, if you're involuntarily dropping things just fall out of your hand, or difficulty with dexterity, buttoning a shirt, or picking up fine things off a table, these may be signs that you're having some nerve injury to the hand. And so we recommend seeing either your primary doc for starters or coming to an orthopedist, and we'll do a physical exam and a history, try to narrow down what that's coming from. Sometimes we'll do nerve studies to determine if it's a localized nerve issue, if it's a systemic issue like diabetes or a disc herniation in the neck. All these can masquerade and cause numbness. So we work that up and then try to determine the best treatment option from there.
Excellent. And before we go, I'm wondering, if we're experiencing pain in our joints, like our shoulder or knee or something like that, is there anything that we can do to sort of alleviate some of that pain on our own?
I always say that the typical male response is put your head in the sand and hopefully it'll go away.
How appropriate.
Right. But seeing that on a daily basis, I think the most important thing to remember is not to ignore the pain. It's your body's sign or symptom that something's not right. And I think for Bob and I, one of the frustrating things we see is patients that have, for example, with shoulder pain, have injured their shoulder and then have waited 6, 7, 8 months to finally do something about it. And unfortunately, if that's a rotator cuff tear and that's torn that long, it may have moved the ball into a position where we can no longer fix or repair that. Yeah. So, within reason, a few weeks, you can sit it out and do the oral anti-inflammatories in time and whatnot, but if it's something that persists, it's worth following up with.
Absolutely. Dr. Aaron Butler, orthopedic surgeon here at Mile Bluff, thank you so much for the info.
My pleasure.
Don't go away, we have more Wisconsin doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center, and we're talking orthopedics today. And my next guest is Marlene Rosenberg, who is the Director of Rehabilitation Services, Audiology, and Home Health here at Mile Bluff. Welcome.
Thank you.
So I'm wondering if you can talk to us a little bit about why it's so important for people to actually go through that rehabilitation process after they've had orthopedic surgery.
Sure. Well, as Dr. Riedle talked earlier today, back in the late 80s, we were keeping people in the hospital a lot longer and doing a lot of their therapy in the hospital. Now we're getting them out in 3 or 4 days, and it's real important that they continue to work on getting the range of motion, the strength, the function back in their arm, their leg, whatever part we did surgery on. Prior to surgery, they probably were having some pain or limitations which were causing them to do things around their home, their work, their lifestyle differently. The body remembers that, and through therapy, we re-educate the body to get it back functioning more normal so they can go about their day-to-day activities.
So the body kind of wants to go back to the way it was before, because
Correct.
That's how it's been for a long time.
That's how it's been for as long as it's been.
Right, and therapy kind of helps to
reteach them.
Yeah, absolutely.
I think most of the viewers are probably aware that physical therapy occurs in the hospital setting, but what other places do you perform therapy at?
Excellent question. We do therapy while they're here in the hospital, but then afterwards people want to go home. That's just normal. They want to get out of here. So we have several different options. Some people are strong enough right after surgery to go home, and then they would come to physical therapy or occupational therapy in a traditional outpatient setting. And we have those here in Mauston. We also have them at Lake Delton and at in New Lisbon at their Crestview skilled nursing facility. We can do outpatient therapies at those places. Sometimes they're not strong enough to go home, and then we have to look at some type of inpatient short-term rehab setting for physical therapy or occupational therapy. And then sometimes they're an in-between, and we really don't know what to do with the person. They can't go home by themselves. They really don't want to go to a skilled nursing facility, and that's when we bring in home care services. We can actually send a physical therapist, occupational therapist, a nurse, or a home health aide into the patient's home to help them recuperate from their orthopedic surgery in the comforts of their own home.
Very cool.
Earlier, Tiffany had mentioned the joint camp that we offer here at Mile Bluff Clinic and at Medical Center. Can you explain a little bit more detail what the rehabilitation service part of that joint camp is?
Absolutely. Like I said earlier, your body remembers things. So our goal in joint camp for physical therapy is to go in and to talk to the patient, teach the patient their basic set of exercises that they're going to be doing after surgery, and encourage that patient to really start doing those exercises before surgery. You start training the brain to go, oh, this is how I tighten up my thigh. Oh, this is how I tighten up my, my calf. So after surgery, when they're having pain or having normal post-surgical pain, or they're having medications that interfere with the patient's thinking process, we've already trained the brain to go, oh, when the patient thinks this, I'm supposed to squeeze this muscle. So it really helps to improve their outcomes much faster. And then during joint camp also we'll go over how to get in and out of your car, how to get in and out of bed, how to use a walker, how to go up and down steps. We'll also at that point in time look at what is the patient thinking in regards to the proper place to go after the hospital. Do they think that they're going to have help at home, that they can go home and we can help them with home care services? Do they need to go to a skilled nursing facility? And get all those things kind of out of the way. The less stress the patient has going into surgery, the better outcome they're going to have.
Right on.
Marlene, I know that patients don't have to have an orthopedic issue to use rehabilitation services. Can you tell us some other services that may be available to patients through physical and occupational therapy?
Yeah, and yeah, today the focus has been pretty much on orthopedics, but down in our rehab department we also have a certified vestibular therapist. Vestibular being somebody who has dizziness problems. Obviously, if they have dizziness problems, they have an increased risk of falling and then subsequently potentially seeing the orthopedic doctors because of the fall. So if we can take care of that problem up front, we're decreasing the risk of falling. We have women's health therapists that can work with different types of women's health problems. Patients who have lymphedema or swelling of their legs, we have therapists that specialize in that. But we don't always work on after injury issues. We also have massage services to help with somebody before they get an injury. It's gardening season coming up here, people are going to be sore. We can work with that.
Awesome. Marlene Rosenberg, thank you so much for the information today. We appreciate having you here today. My guests have been Marlene Rosenberg, physical therapist and director of rehabilitation services here at Mile Bluff, as well as Tiffany Hall, certified medical assistant of orthopedics, Dr. Robert Ridley and Dr. Aaron Butler, both orthopedic surgeons here at Mile Bluff Medical Center. On behalf of Wisconsin doctors, all of us here at Wisconsin Doctors and CW57, we're inviting you to live longer and live better. We'll see you next time.